Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Anwar Shahzad. Today I will speak on an important topic, that is HPV vaccination, that is human papilloma virus vaccination. So it is that there is a campaign these days that the government is encouraging, trying to suggest the people that they should help and support this campaign. So, first of all, we will see what is a vaccination and how does it work. So, vaccination is the production of antibodies. Then we enter any antigen into the body of a living. It produces against that antigen antibodies, which are actually for to kill that antigen. But if the antigen is more potent, it can cause disease. So the way when we see, we will table some lethal diseases which can cause loss at a mass level, at a national level, at a country level, so at the world level. So the government and other some institutions, they work on it, and they think that how we can prevent this lethal disease. So they work on its preventive aspects. That is how we can prevent this, firstly, and later on how we can treat it. So the preventive aspect is very good if we can prevent some disease. That is much more better than we treat the disease. So it is also said prevention is better than cure. That actually, and that really means, really, it is very important thing to say that instead of suffering from the disease or treating the disease at a later stage, and it is caused, and when it causes damage to the a person, the living persons, of course, we can prevent this if we can. So we will try to prevent, and that is only possible by observing hygienic principles. That is, we can have cleanliness and hand washing from infectious diseases, and the vaccination from these diseases which are caused by the organisms, especially bacteria and viruses, or any other protein particles which can enter into the body and they produce antibodies. So when we introduce this bacteria or virus in an attenuated form, a killed form, or their structures into a living person, living animal, it produces antibodies. These are this produces antibodies, but these organisms which we introduce into the body, they are not able to cause the disease. So it means we are just want to produce the antibodies against that disease by entering or by injecting or by these organisms which are killed or attenuated or their structures, so that these antibodies will remain in the body of that animal, and whenever in life he or she and it gets that disease, that is gets the organisms enter into his body, they will be killed by these antibodies. So again, in simple words, if we want to prevent us from certain diseases, and they and we have got invented, discovered the vaccines against them, we should this act on and consider these vaccinations instead of giving negative opinions. So as there is a program in our country, EPI program, That is, there are certain vaccines which are injected to every newborn up to some age, so that he can be prevented from these diseases. And the polio is one of them, and other diseases as well. And this is a vaccine that there are very zero almost cases of the polio or other diseases because of this polio vaccination. So vaccination is very important to prevent diseases, and these days the campaign is against this CA cervix, that is the cancer of the mouth of the cervix. It is caused by human papilloma virus 16 and 18 strains. So it is said, it is being programmed that the girls from 9 to 14 years, they should be given vaccine. They should be injected vaccine, so that this age is they are not exposed to the intercourse or this virus. So before this introduction of the intercourse of the later life, we will give them vaccination, and they will produce, they will have antibodies against this papilloma virus, human papilloma virus, and whenever they get infected or this this virus, it will be killed and it will not be able to cause the disease. So as there are rumors, it's people, different people, they are giving negative these opinions. But if we see that this is a gift, this is the blessing of the God that we have got this vaccination, and many of them, thousands of the people, they will be saved. And as it is said that this CA cervix is second most common CA cancer after the CA breast. So we see the patient from CA suffering from CA breast, they are in a very pitiable condition. So it is whenever we heard the word cancer, we get terrified. So before this disease and comes, and we can prevent it. So it is our duty to stress upon it, to suggest or to tell the people that this is not this dangerous. Vaccination is not dangerous. It is rather very much helpful and fruitful, and will prevent the disease which is very lethal, that is CA cervix. And the CA cervix, uh, this is the disease is this 1, 2, 3, 4 stages. And if one gets the disease, the CA cervix, she will be having very this complications and morbidity and ultimately death. So to prevent this morbidity, complication, and death of our this the relatives are with the belongings, so we should give vaccination to every girl from 9 to 14. If there are 1 or 2 doses, and if the girl is beyond this age, she also again can be given the doses, but they can maybe 3 doses. So there is again, to conclude, is that vaccination is very safe. As we know that these vaccinations, they are invented after many months and years of the experience, this experimental work on different animals, on different even so that they can see the response and their side effects and these things. So it is first of all, it is in becoming taking it to the market. They are this done. The experiments are done, and when they are satisfied, the authority as a institution is satisfied. Only then they apply to the human beings. So again, one should have vaccination in the early age. The girls 9 to 14 years, and we can say if we can want to have a healthy nation, we should have the vaccination. So again and again, I stress, please cooperate with the agencies which are the departments which are doing this vaccination, and this vaccination is safe, and God bless you. Thank you. That's